I will give a quick introduction about Zainab Bain. She's from Pune and she has done BHMS, NCAH, PGDAMS, and PGDPC. And after doing these degrees, she has started her clinic, Raj Clinic in Pune, since 2017. So I guess 8 years thaya hai, right? Right.
Yes.
And she is well-known hormones and fertility specialist in Pune, and also online consultations with Kare Seven. So, looking forward to have some great value from her today. And we have managed to do this after a long time. So I'm happy and excited too. And also she creates great content on her page, and with that she has managed to get 139K followers, which is like very rare. Bohra pages have these 100K plus followers. So congratulations for that.
Thank you
And
so much.
yes, so we are going to talk about fertility and hormonal balance and those stuff. So I would like to know, okay, what are some of the common myths or misconceptions about infertility and those topics which you come to know in your daily consultations?
Okay. So before I start, thank you so much for having me, Hussain Bhai. I think it is your persistence that has finally got us to this live session. And I will start with your question. You mentioned, K, what are the common myths that we tend to see, especially related to infertility? Pehla to, the most common one that I come across in my practice is that infertility is equivalent to कि बहिरा होमा कोई problem છે. It is a woman's problem,
Right.
which is something we very often see, and that's the perception that has been created in the society. So ઘણી વખત જ્યારે treatment વાસ્તે પણ આવે છે, તો it's only the woman who's coming for treatment, and the man is not a part of the entire session. But however, there is so much of scientific evidence, data, day-to-day practice, we see that it is equally both the couples that have an equal contribution to make in the entire baby making process. So both men and women, 50% chance for they being the contributors to infertility. બીજું એક myth જે જોવામાં આવે છે કે just because we have first child, second child માં हमारे infertility नहीं हो सकती. But that is again something that we see very commonly, that people have conceived very easily the first time, but have a second time they are struggling. So we know so many problems can happen with age, with times changing, post pregnancy in women, even with men. Just because previously the issue does not always mean that they would not have any issue now. So secondary infertility is also very, very common lately.
Okay.
Yeah.
So and these are the two most common
ones. Yes. પછી તો there are so many others. નાના જે આપને ખબર પડે છે, but the two most common ones are these that I have definitely come across.
Okay, fine. So now let's touch the first topic, and as you are expert of that, okay, how do hormonal imbalances affect fertility in both men and women? Because I guess both the topics are very much related, so you can tell more about it. And what are some early signs કે જેના આપણે alert થઈ જવું જોઈએ કે you need to go to a consultant?
Okay. So firstly તો એમ છે કે for women, the signs and symptoms of hormonal imbalances are very prominent because they go through monthly periods. So એનામાં કઈ changes આવે. So we know evidently, which is not the case with men. So for men, most probably, unless and until you run investigations, we don't necessarily understand કે એ લોકોમાં કઈ problem છે કે નથી. So first I'll tell you about women. Now, even if minor hormonal changes hoy છે, so most commonly it affects your periods. So we start seeing symptoms of irregularity in periods. Periods scanty થઈ ગયા છે, heavy થઈ ગયા છે, બરાબર time પર નહીં આવતા. 3-4 days up and down is something that we scientifically consider as a normal. But if your periods are getting delayed, they are coming more frequently, that's one most common thing. બીજું એમ હોય છે કે because of the hormonal issues, PMS becomes more prominent. So PMS is usually when the periods are about to come. એના આપણે 1 week થી 10 દિવસ પહેલાનો period ને PMS કહીએ છીએ. So it's a premenstrual syndrome જેનામાં એક કહીએ ને you get that idea કે હવે periods આવવાના છે. So પેટમાં દર્દ થાય, you have other symptoms. So all of these symptoms become more prominent. Mood swings become more prominent. There is more irritability. રોવાનું આવે છે, કઈ કરવાનું મન નહીં કરતું. So all of these symptoms become more prominent, which is a sign that somewhere your hormones are not as balanced as they should be. Pachi, we know that PCOS and everything is also one very common condition that women deal with. And again, we tend to see a lot of hormonal imbalance symptoms there. Okay, face par baal aava, વધારે hair fall થઈ જાવું. You would have a lot of weight gain and you have difficulty in losing that weight. Weight gain is specifically happening in the belly region. So all of these are certain common symptoms that we see in women. Again, like I mentioned, with men, since we don't evidently see anything, unless and until they get themselves tested, we wouldn't really know where the problem is coming from. So એ બી એક પ્રોબ્લેમ થઈ જાય છે ઘણી વાર that men feel that just because they don't feel anything, there is no problem with them. Problem બૈરોમાં જ છે because એ લોકોના hormonal issues તો દેખાઈને આવી રહ્યા છે. So they don't want to get themselves tested. They feel all the problem lies within the wife. So that is something I always urge all the men to do. Okay, at least get yourself tested. Get the semen analysis done. Get your hormones checked. So we would know if the problem exists कि નથી exist કરતું. So કમ સે કમ अपने પછી direction મિલે છે ટ્રીટમેન્ટ કરવાની.
ઓકે, ટેસ્ટની આપ વાત કરીએ છો તો કે એના અંદર કોઈ એવી સ્પેસિફિક ટેસ્ટ કે આપણે જે કરી લેવી જોઈએ જેનાથી આમ અંદાજ આવી જ જાય?
Definitely. For women, there are a few basic investigations that we do recommend. તો પેલો તો આપણે hormonal test કરાવીએ છીએ. So એનામાં the most common ones are FSH, LH, prolactin, thyroid, અને તમારું estrogen या progesterone જે બી છે. Now all of these tests are specifically done on the day 2 or day 3 of your period. અને then we get a basic sonography done just to check કે internally uterus, ovaries, follicles આ બધું okay છે કે નથી. There is anything that is pathologically abnormal.
Okay.
So these are very, very basic tests. You get AMH tested to understand કે ovarian reserve કેવું છે. And then based on what imbalances we are able to figure out in these, then we then recommend कि okay, agal have further testing, what can be done. With men, the basic test is a semen analysis. So enama you check the sperm count, sperm motility, sperm morphology. And if at all there is something that's not right in that entire test, then we go into further testing. કે પછી આપણે એ લોકોના hormones check કરાવીએ. We then go and test the sonography of the scrotum. So then we go into further details as to why that problem is arising.
Okay. I guess we have some questions coming.
Yes.
I think we can take them later.
Yes, definitely. I think we can take them at the end of the live.
Okay. હજી એક ચીજ મને હમણાં દિવાળી આપણે વાત કરે છે તો ધ્યાનમાં આવે છે કે વિમેનમાં ઘણી ચીજો હમણાં એકદમ કોમન થઈ ગઈ છે કે લાઈક PCOS and all that. So આ કઈ तरह થયું લાઈક એટલું કે મેં એકદમ જ થઈ ગયું છે લાઈક what would be the ratio like in 10 what would be the number of women facing this?
I would say 1 in 5. 10 भी घना થઈ ગયા. मतलब हर 10 માં 2 women struggle with it. In fact, that's what તમારે statistically ખબર પડે છે. But I think it's almost become extremely common. Every second woman that I deal with has PCOS. Even हमारी practice ના અંદર हमें જોઈએ છે કે 70% women who are struggling with conception are women who have PCOS. And bakina 30% might be some other causes like endometriosis, fibroids, બીજા કઈ issues છે, unexplained હોય છે ઘણા cases. So somewhere I think number one is it boils down to our lifestyle. We don't eat as clean as women back then used to eat. अपनी physical activity ઘણી જ કમ થઈ ગઈ છે because we have everything at our fingertips now. કઈ મંગાવવું હોય તો ઘરે બેઠીને મંગાવો. There is no physical labor as such that is involved. જે પહેલાના જમાનામાં એ લોકો બધું જ વસ્તુ હાથથી કરતા હતા, which is all gone down. There is very minimal exercise that we tend to do as women, unless you are aware कि अपने करવું જોઈએ, કઈ બી નહીં થાતું. The food that we eat is not as pure, as good as it used to be. હવે તો we also recommend women not to have a lot of dairy because we know कि cows ને પણ એટલા બધા injections આપવામાં આવે છે in order to increase production. So there's so much of adulteration that happens in the food, and ultimately that all ends up hampering your own system. So I think what is really needed is there has to be some form of awareness of શું basic lifestyle changes છે that you need to maintain in order to have a good hormonal cycle. Because કેવું છે, it's not only women having PCOS, but I think everything is changing. Even young girls, પહેલા they would start their periods around 15, 16 years of age. Now girls as young as 9 and 10 get their periods. જેનામાં it is so difficult to even educate them. તમે 9 વર્ષના personને શું સિખાવશો? That what is a period? How do you deal with it? So it is that it's very important from a young age for you to start becoming aware of, you know, what is good diet for you. Cut down on all of these chips, biscuits. It's so easily available and it's so addicting hoy cha sagli vastu that even kids want to eat it. Even once you feel hungry, it's so accessible ke chip nu packet le do apne khai le. So it's very important that one thing we always tell people is cut down on junk. You know, chips, biscuits, completely, you know, stay away from them. Sugars, મીઠું વધારે નથી ખાવાનું. We ask them to avoid a lot of fried foods. What we say is that stick to simple home cooked meals, because one, you know that, you know, you are cooking it at home, so what kind of ingredients go into it. You are also careful कि તમે wash કરીને બરાબર છે, you're using good quality oil, you're using good quality food, so it makes a lot of difference. But the entire problem is then કે our food is mainly carbs. अपने फकत रोटी ने चावल खाઈએ છે. We are not really aware of food ના અંદર fiber भी હોવું જોઈએ, food ના અંદર protein भी હોવું જોઈએ. You can't really eat only it with some source of fiber. You have to pair it with some source of protein. So I think all that proper education and awareness jivare hoy, and you start becoming conscious of your food, balancing your plate, eating healthy, it will cut down your health related problems into half. And even long term longevity vaste, it really makes a lot of difference.
Okay, so from this we can summarize ke ek to avoid junk food as much as possible, and second is do some exercise and be little active, so that can help you.
Do some exercise, definitely. You know, you hit the gym, you go for walks, you do yoga, whatever. But then the problem is that अपने दिवस में 1 કલાક exercise કરીએ છે, the remaining 10 hours a day you are stuck to a chair, which is also not something that we want. We want movement to continually happen. So even if your work involves you to be sedentary, at least make it a point कि अपने हर 1 કલાક में उठीने ચાલીએ, अपने you know 10 મિનિટ ચાલી રહ્યા છે. Every food પછી, especially after your lunch and dinner, make sure that you are walking a little. It could be slow paced walking, but you know, around the house you're walking, around the office जहाँ भी છે. So you know, make sure that it is basic movement જેની જરૂરત છે, you are getting those movement in, you're getting those steps in. It can really make a lot of difference, especially if you do it consistently.
Okay. हमना पे લાઈફસ્ટાઈલ ની વાત કરી, તો એના અંદર એક ચીજ જે આપણા લાઈફસ્ટાઈલ માં આવી ગયો છે, which is stress. So I would like to know કે stress નો આ સગલી ચીજો પર કઈ તરહ અફેક્ટ થાય છે, લાઈક ફર્ટિલિટી પર, અને ઇન્ડિવિજ્યુઅલ્સ ને શું પોઝિટિવ ચેન્જીસ ખુદમાં લાવવા જોવે તાકે એ લોકો આ પ્રોસેસમાં થોડું કન્વીનિયન્ટ થઈ જાય એ લોકો વાસ્તે.
Okay, so firstly, stress, so it is almost like it's become a part and parcel of our life. You know, अपने कोई वक्त भी it's very easy for me to say कि अरे तमे stress ना ले जाओ, but we know कि practically that's one of the most impractical advice that I could give anybody. So what we really say is stress तो आओ से, but you have to learn to manage that stress. कि okay, कई stress आयु, I'm feeling about it. One thing that I quite often tell people to do is that if there's a stress that is coming, just write it down. You know, write down ke su vastu nu mane stress છે. Okay, I'm worried about my office work, I'm worried about my exams, I'm worried about relationship, I'm worried about something. Enamasi, try and identify ke su vastu is under my control and su vastu is not under my control. If there is something that you know कि आ वस्तु ने मैं control नहीं करी सकती या नहीं करी सकतो, completely scratch it out. You know, when you know that something that is not under your control, stressing about that particular problem is not going to lead you anywhere. પછી અગર કઈ problem છે which is under your control, try and identify what steps you can take to rectify that problem. તો એનામાં શું થાય છે ને, you are becoming more productive. You are trying to focus on the solution rather than the problem. Because what happens is stress primarily comes from thinking more about the problem. આ કેમ થયું, આ આમ કેમ કીધું, આ આમ કેમ કરું. આપણે continuously problem નું સોચી રહ્યા છે. અગર તમે તમારું you try to divert yourself from the problem to the solution, I think you start thinking more logically, and you also, your body kind of calms down. So it really helps. બીજું કે એક એવરીડે બેસિસના ઉપર છે ને if you are somebody આપણે કહીને personalities હોય છે, there are people who are anxious personality. If you believe that you are one of those, it is very important કે તમે એવા practices अपनी daily life માં include કરો which is going to help you reduce that stress. So જેમ કે journaling થઈ ગયું કે okay, I'm writing it down, I'm getting thoughts out of my mind onto a paper, I'm trying to logically see things, which is then going to help you. You know, try and inculcate some form of physical activity because again अपने research से खबर है कि you know physical activity helps you calm down. Try and do deep breathing, try and meditate. So there are so many small things. Do activities that you personally enjoy, જેનાથી you know તમારે અછું feel થશે. So again, આ બધી નાની practices તમે અગર include કરશો અને એને consistently follow કરશો, so in the long term you will see benefit in how you cope up with that stress. But when it comes to infertility, jo little bit of somebody who's chronically stressed, har vastuma stress lai chhe, there are a lot of things happening around you that is stressing you out a lot, then in that case, yes, you know, your cortisol tends to rise. And ena sabab it affects your periods, your ovulation, your overall health. Even with men, we see it affects their sperm count, motility. So in that case, then one, stress management becomes mandatory for you. And sometimes then we also recommend supplements like magnesium shea ya biju kai shea that can help you cope with that stress a little better.
Okay, fine. હવે આપણે ટોપિકને બે ચીજમાં ડિવાઈડ કરેલું હતું. એક તો ઇન્ફર્ટિલિટી ને હોર્મોનલ એન્ડ સેકન્ડ વોઝ ધ સપોર્ટ સોસાયટી શુડ ગીવ. હવે એના અંદર એક વાત કરી કે શાદી પછી જ્યારે આ પ્રોબ્લેમ ફેસ થાય છે કે નથી થઈ રહ્યું અને પ્રેશર આવે છે ત્યારે પહેલા તો કપલ્સ એકદમ સ્ટ્રેસ થઈ જાય છે એકબીજા સાથે. So how can they approach this emotional toll of these issues they are facing? And what kind of support system they should make for themselves કે એકબીજાની સપોર્ટ કઈ તરહ એ લોકો કરી શકે so that they can stay calm?
See, firstly though, it's important for anybody to understand કે stressing about when will I conceive, or even as a family જ્યારે કોઈ તમે પ્રેશર આપો છો કે ભાઈ you know it's high time ફરજંદ કરી લો, it's time for you to fall pregnant, but just because you want it or just because somebody else want that એ નથી થવાનું. You know, conception will happen when it is destined to. In fact, working under pressure only makes the entire journey all the more difficult. So it's very important for everybody to understand that you can take proactive steps towards it, but you can't control कि ये outcome अपने किवारे मिल से. And as a couple, what we've seen is jivare somebody struggling with fertility, no, ya to couples can be on a same page, yeah, because of that there are constant arguments and fights that are happening between them, which makes the journey all the more difficult. So firstly though, it's very important for a man and a woman to sit down and talk to each other clearly about it, because communication is very important. There should be no assumptions in the relationship ke probably mara husband ne khabar hai che mane shu feel thai che, yeah, the husband is thinking my wife knows what's going on. Maybe they don't know. You can't really read each other even if you've been together for years. So it's very important that you sit down and clearly communicate that this is what I feel, this is what is happening, this is what I'm okay with, this is what I'm not okay with. So at least the basic thing that the both of you are on the same page in this entire thing. Secondly, what happens is in that race to fall pregnant, a lot of things take a back seat. Tamari relationship takes a back seat. Your sex life takes a back seat, because then everything has become about okay apne fakat try karwanu છે, apne fakat ફરજન જોઈએ છે, you know, irrespective of things. But again, you know, that doesn't serve any purpose to you. So what is important is, of course, a child is important, but your relationship is equally important, and you can't do it at the cost of your relationship. So you have to learn to prioritize each other. એકબીજાને સમજવું, એકબીજા વાસ્તે time નિકાલવું, you know, doing things outside of just thinking about fertility. It can really make a lot of difference, because just falling pregnant is not everything. It is a part of your life, but it is not your entire life. Ultimately, your relationship with your partner equally matters. So એક વસ્તુ હોય છે. ત્રીજું એમ કે ઘણી વખત, you know, we talk about so many things related to fertility કે okay તમે આ ડોક્ટર પાસે જાઓ, આમ કરો. What we don't really take into consideration is how much of an emotional toll it can take on a couple. So we don't really consider mental health as a problem. We've seen women get depressed, we've seen women get anxious, we've seen women go through all kinds of things. Similarly, even for men, there are so many emotions that they also experience throughout the journey. But I think nobody kind of makes it a point to address it. So pehla to it's important for you to speak it out, at least with somebody who would hear you. Because એક તો there is so much shame around it ને કે મેં કોઈ રીતે કોઈને કહું કે મને anxiety feel થાય છે કે મેં કેવી રીતે કોઈને કહું કે I am sad. So there is no safe space that we as a couple are creating or we as a society are creating for somebody to at least share what they are feeling. તો એક ઓલું safe space અગર તમે create કરો છો એકબીજા વાસ્તે તો it not only strengthens your relationship but also makes this journey better until you reach the outcome.
Right. Okay. So communication is very important. Firstly, between couple, and then also if family is pressurizing, they can tell and they can share it. Maybe I say whatever. So communication is the key. જેનાથી issues એ લોકો solve કરી શકે.
And secondly, કેવું હોય છે ને, like some couples are open to sharing things with family, but some couples are not. So sometimes a boundary as a family, as a society, we also need to understand that if they don't want to share what is going on with them, if they don't want to share about their journey, if they don't want to share about their treatment, we have to learn to respect it. Instead of wanting to know everything, instead of wanting to control everything, instead of wanting to, giving them advice constantly, because it's not helping. તમે couple help નથી કરી રહ્યા, you are only making things worse for them. So I think that is something we need to understand as somebody who's along with them, because अपने એમ છે કે તમારે એમને સપોર્ટ આપવાનું છે, તમારે એમનું જર્નીને ડિફિકલ્ટ નથી કરવાનું.
Okay. Now let's talk about those couple જે લોકો try કરી રહ્યા છે, but now what is the point કે જ્યાં એ લોકોને સમજી લેવું જોઈએ કે હવે આપણે કોઈ કન્સલ્ટન્ટ પાસે જવાનું છે અને આ ચીજો શેર કરવાની છે. અને હજી બી ઘણાને અગર લાગતું હોય થોડું અનકમ્ફર્ટેબલ, તો પ્લીઝ યુ કેન ઇફ યુ કેન ટેલ કે ફર્સ્ટ કન્સલ્ટેશન જ્યારે થાય છે તો વોટ આર ધ થિંગ્સ યુ ડિસ્કસ સો દેટ એ લોકોને થોડું લાગે કે હા નાઉ it's time for us we can get comfortable and we can go to some consultant.
Yeah. So usually agar apne medically baat kare, so it is that if a couple is trying for 1 year, and when I say trying for 1 year in the sense that they are understanding ke ovulation periods શું હોય છે, they are trying accordingly in that period, but Toby they haven't been able to conceive, that's when we advise them to go to a doctor and get all the basic tests done to understand ke where is the problem coming from. So કામ નથી થઈ રહ્યું. Secondly, if the woman is above 35 years of age, we know that in women, fertility is often tied to your age. Jim, your age progresses, your fertility does decline because of that. Then in that case, for somebody who's above 35, we say that try naturally for 6 months. Agar 6 mahina pachi you are not able to still conceive, it's always better that you get medical assistance and help. And if you already know कि भाई there are certain coexisting problems that are existing. For example, if the woman knows कि मैंने PCOS છે, मैंने endometriosis છે, you do have certain concerns that could be a probable reason where conception would be difficult for you. It's always better to go to a doctor sooner instead of just waiting on it and then going to them expecting some quick results. So that is the primary timeline that we look at. Biju ke when you ask me that what do we really do in the first consultation, so our first consultations are all about understanding every basic thing about that couple, about the woman, about the man, right from what issues they suffer from physically to emotionally to understanding their entire lifestyle to trying to know what things affect them, what things don't affect them, what treatments they've undergone, and then accordingly we devise a plan. So now talking about homeopathy primarily, something that I've seen in my practice is that a lot, actually very few people come to us as a first resort of treatment because ઘરાને તો awareness જ નથી કે homeopathy ના અંદર બી fertility નું treatment થાય છે. या પછી they are of the opinion कि homeopathy તો ઘણું slow કામ કરે છે, તો આપણે fertility treatment કરાવશું તો ક્યારે conceive થશે. So it's always the last resort that we've knocked all the doors, we've gotten all the treatments done from the gynecologist, we've gotten IUI done, sometimes even IVF done, બધું ફેલ થઈ ગયું છે, now we are thinking કે હવે શું કરીએ, so that is when they want to try homeopathy, which is what it is. In that case, we really try to understand all the treatments right from the start and then give them solutions possibly as to what can be done.
Okay. हमने पे होम्योपैथी ની વાત कर रहे थे, तो आई वुड लाइक टू नो मोर કે आप કઈ तरह कन्विंस કરી શકો છો કે they should go for you for homeopathy at the first option.
See, to be honest, everybody wants to conceive naturally. There are very few who have certain issues જેનામાં assisted reproductive techniques are the only resort for them. If you are talking of natural conception, there is absolutely nothing that is better than homeopathy, because one, our treatment is extremely gentle. તમે દવા લેશો તમને ખબર બી નહીં પડે, as compared to allopathy, where you have to take tablets, you have to take injections, there are ovulation studies, there are a lot of things done. We try to keep the treatment as simple as possible, considering how much of an emotional toll this entire treatment can take on the couple. Secondly, our results are almost equivalent to what any allopathic treatment would provide. So I would say, in fact, better. So it is definitely, there's a lot of scope. The testimonials speak for it, the reviews speak for it. It's just that people need to be aware that, you know, एक time હતો કે પહેલા કહેતા હતા કે homeopathy ઘણું slow છે, નહીં થાતું. But I think we've come way past that. You know, science has advanced, things have advanced, the results speak for themselves. So if there's one thing I would want to urge somebody is that before you knock any other door, you should definitely try homeopathy. The results would amaze.
Okay. અને આપણે કન્સલ્ટેશન ની વાત કરતા હતા, એના અંદર मैं just पूछ रहा हूँ कि both are very important for you to sit in front of you, right? Like
again, see, I think it is case to case variant, but primarily what is important is બેવેના checkup થવા જોઈએ. Then okay. If we feel कि okay, you know, the man does not have any problem and basically bairon under issue है, so okay, then we only treat the woman. There are certain cases where the woman does not have a problem, the male's reports are not the best, and in that case we only focus on them. Okay. There are also cases of unexplained infertility. Almost 30% cases એવા હોય છે કે બધું જ બરાબર છે પણ નહીં થાતું તો પણ, you know, we are not able to identify any medical reason as to why they are not able to conceive. In that case, then we recommend both the husband and wife to onboard for treatment, because you don't know where that problem is stemming from.
Okay, so coming to our last question, and very important one, I guess, જેના ત્યાં live આપણે કરો છે, how can families and society be more supportive and empathetic towards this couple who are struggling and who are trying for like I guess many years to get the results? So what are the things they should take care of?
See, irrespective of whether a couple is trying for many years, they've only been married now, the primary problem is that we as a society have set a timeline કે શાદી થઈ ગઈ તો પછી તમે next time મિલશો તો first સવાલ is, અરે, are you pregnant? બચ્ચું છે કે નથી? So I think sometimes agar people who are struggling to conceive know, it is almost like તમે એના pain point પર ઘડી ઘડી હાથ મૂકી રહ્યા છો. So it's not a very easy thing for someone to answer, especially when you know કે મારા પાસે જવાબ નથી, you know. So sometimes we really need to understand that the best thing is not to ask any questions, especially related to this. You know, nobody will ask you તમે કેમ છો. People will ask you બચ્ચું છે કે નથી. I don't know why would somebody do that, but I think we should really refrain from asking such kind of questions, especially publicly. બીજું કે કેવું છે ને, we've created so much of shame around infertility કે અરે આના પાસે બચ્ચા નથી, you know, this particular person doesn't have a child, that people don't even want to talk about it anymore, you know. In fact, I have also had patients who don't like going to social gatherings because they are like, the people continuously keep asking થોડો weight put on થયા હશે, they'll be like, oh, you've put on weight, pregnant છો તમે. But you understand, when you don't have a child, even when you desperately want it, something as simple as this question can also feel so hurtful. So this is one thing, we need to respect the privacy of everyone and not ask these kind of questions. બીજું કે અગર ખબર પડી જાય છે કે okay, this person is not having a child, they are struggling, the first thing people want to go and do is give advice કે અરે ઓલા ડોક્ટર પાસે ચાલા જાઓ, આ ડોક્ટરનું ઘણું સાંભળ્યું છે, આમ કરી લો. Maybe it's coming from a good place, you know, they are wishing good for the couple, But of course, e couple apna tarika se try કરી જ રહ્યું છે. Sometimes your advice can really feel very overwhelming to them. So unless and until somebody is not asking you for an advice, please don't provide it.
Okay.
So, agar કોઈને તમારી help જોઈતી હશે, they will definitely ask you. If not, refrain from giving general unsolicited advices to people.
Okay.
ત્રીજું એમ કે કેવું હોય છે, support in a way is also by just simply being there for someone. So, ઘણી વખત શું હોય છે કે we only listen because I want to tell you something in return. We don't listen just because we want to provide a good space for somebody to vent out. So sometimes if we start doing that, we let people just speak without the fear of judgment, without the fear કે આ મારા બારામાં શું સોચશે, આ કોઈને કહી તો નહીં દે. So it does make a lot of difference, and we really need to, at the end of the day, respect the couple's privacy. If they want to share something, they will come and tell you. If they don't want to, we have no right to go and ask them questions, to force them to answer us. It only makes the entire journey very difficult for them.
Right. Okay, I guess now we can take the questions.
Yes, please.
I guess I had given you a question which was asked on story. आपना भी story पर कोई questions हो तो you can just.
Gee, I will just check 1 second.
Yes. અને હમણાં भी कोई अगर questions નાખા હોય तो please आप अगर पाછા repeat કરી
I'll
सकता हो
just
तो.
see in the live if there are any questions.
I guess someone was asking on story કે homeopathy માં fallopian tube નું કોઈ
Tube blockages no કહી શકે નથી. So honestly, in that case, we really need to understand that what is the reason from a blockage. So is it hydrosalpinx? Is it some adhesions? Is it some other reason? Now, I would say most of the cases, homeopathy does not really assist so much with fallopian tube blockages. Especially, that is something I say from my practice. So in that case, surgery does become the first resort of treatment. But fallopian tube blockages nahi clear thata.
Okay. I repeat, जे भी questions ऊपर नाखा हुए please पाछा type करिए because we are not able to scroll. There are so many messages. So please आप पाछा type કરી सके so that we can check
Okay.
it.
So somebody has messaged કે મારી daughterની period હોય છે ત્યારે બહુ માથું દુખે છે. So શું reason હોઈ શકે છે? So again, this is hormonal. Headaches before periods, headaches during periods. આ સગલા આપણા hormonal imbalances ના સબબ જ થાય છે. In that case, what really is important is that one, કે તમે આખી lifestyle ના ઉપર કામ કરો, focus on the overall diet, focus on including some form of physical activity, અને period start થવાના પહેલાના phase try and include more magnesium rich foods in the diet, so that can really help.
Okay.
Another question is AMH is 1.12 at the age of 40. क्या ये normal है? 2 years हुआ शादी को, conceive नहीं हो पा रहा. So AMH is pretty decent for the age, so I don't think AMH is the issue. It is more important to run other investigations and understand. And most of the tests that I recommended in the live are very basic investigations. If all of those are normal and still things aren't working out, you would have to go for more further testing to understand why is the conception not happening. Is diabetes the biggest problem when it comes to male infertility? Yes, see, diabetes does affect the sperm count, motility, etc. I wouldn't say it is the biggest problem, but yes, it is something that definitely needs to be controlled. So if your sugars are controlled and balanced, it can positively also impact the sperm count. So it is completely based on your lifestyle and how you approach medications. So if you are able to take care of the diabetes, there would not be any problem. Okay, somebody is asking, I need an online appointment from Saudi Arabia. I'm sorry, Ravita, we cannot ship medications to Saudi Arabia because of custom restrictions. So if you have anyone from India who can carry medications for you, we can opt for an online appointment. Okay. Anybody else has any questions.
Yes, you can type. Okay, so now let's move to our next section, which is a kind of rapid fire. Okay, we have one question. Does homeopathy help with blood clot
Blood clot
forming?
formation. Blood clot formation during pregnancy. Okay. See, in that case, homeopathy does help, but alongside you also have to opt for other blood thinners because during pregnancy we really can't risk it. It is more important to make sure that you are providing the blood supply to the placenta and the fetus is not compromised. Okay.
Okay, so okay,
Okay.
so I will ask my first question. Like,
Yes.
what is that one word or one line which you would like to describe your journey of being a doctor, specialty related to this pregnancy?
I think gratitude. I
Gratitude.
am,
Okay.
yes. You want me to elaborate on that?
Yeah, please.
No, I genuinely am extremely grateful that I get to do the work that I do. I mean, every day when you sit with couples and you speak with them, हमारा consultation इतना detailed होता है. We take up to an hour. We try and understand a lot about their life, about their history, and you genuinely feel so grateful that you get to build those connections with them. And especially when એ લોકોની journey આખી પૂરી થાય છે, when they conceive and they have a child, it definitely is the most fulfilling experience that you can ever have. So I am very, very grateful to experience that.
Okay. So next question would be, as you said, your consultation calls are long. So what
Yes.
relaxes you after a long consultation call?
My daughters.
Okay. So how do you manage? Like, you would be in clinic, she would be in home, she would be at home, I guess.
Yes. So I live in a joint family setup. I have my in-laws. So I am touchwood very, very grateful for having them around. They take care of the kids while I'm away.
Okay. So third question would be, what is the most underrated health advice which women get?
Eat less, move more. I think this has become the norm. So for everything, what I've personally seen is that if you have PCOS, lose weight. If you have endometriosis, lose weight. If you have this problem, lose weight. And lose weight is equal to kam khao ne vadhare chalo. But we now know that that advice doesn't really work. It's more important for you to be so mindful about how everything affects your hormones. So it's not about eating less, it's about eating right. It's not about moving more, but it's about moving consciously. So I think that is something that needs more awareness.
Okay. Early morning calls or late night calls?
Early morning calls, any day. I am not a late night person.
Okay. A healthy mantra you follow strictly for yourself?
Happy wife, happy life.
Okay.
I try to not stress about majority things in my life. I am the kind of person who just kind of goes with the flow. Whatever comes, I deal with it, and then I move forward. So I think that's one thing that I always follow. I feel if I will be happy, I will be able to be available for my patients. I will be able to be there for my family, which is very important.
Okay. Happy wife to કહી દીધું મોહમ્મદ ભાઈને પૂછવું પડશે. What about him?
Ali bhai, yes, પૂછી લેજો.
Okay. So if not a doctor, what would you have been?
Social media manager.
Okay, right. Perfect. Okay. Describe your content creation journey, like how you started and how you got so pro at it.
I think it is all practice, especially when I think also because I enjoy making content. It is not just coming from a place jivare apne karvu pade છે, but it's something that I really like doing. I like putting out things. I like when people tell me that my content has been helpful. I like when they learn something from it and they apply it and it really helps. So it's just that just because I enjoy doing it so much, I have always been on the journey of making things better. So maybe investing in a better gear, investing in learning certain skills, or getting myself better on camera. I think that's made a lot of difference.
લાસ્ટ ટાઈમ આપણે જે વારે વાત કરેલું લાઈક ઘણો ટાઈમ થઈ ગયો તે વારે મેં એક ક્વેશ્ચન પૂછેલો કે લાઈક લોકો તમારે પૂછતા હશે કે બિંગ અ ડોક્ટર યુ આર ક્રિએટિંગ રીલ્સ એન્ડ ઓલ દેટ, બટ હવે તો એવું થઈ ગયું છે કે લાઈક ઇટ્સ મેન્ડેટરી ફોર એવરીબડી, લાઈક
Yes,
મેજર
yes, it
એક્સપર્ટ્સ આર
is.
ડુઈંગ ધીસ.
It is. It is. Social media has become an inseparable part of our life, and we absolutely cannot deny it. So you have to be a part of it in order to run the race. So I think that's needed now.
Right. So world is shifting on it, so you have to make the best use of it, I guess.
Done. Done. I agree.
Right.
100%.
One case study, if you would like to share, which was the best one, like which made you very proud.
Okay. So I have a lot of them. A lot of them very, very close to my heart.
Okay.
Okay. Some of them I can't really name, so I'm really thinking मैं सू कहूँ तुमने. Okay, I'll talk about this particular one. I've also spoken about it multiple times, but it is something that is very close to my heart. So I had this one patient who had come from UP for a consultation, MP UP. I don't really remember exactly where. So she stayed in the inners of that particular state. So when she came to meet me for a consultation, she wanted to come in person only. We gave her the option of online, but she insisted कि नहीं मैंने personally आवीने मिलવું છે. They had traveled for almost 24 plus hours to come and see me for a consultation. That particular couple had been trying for around 12, 13 years. And when she came to me, she'd gotten like a big file of so many tests, so many investigations, procedures, everything done. And she just because she came from a very inner village place, there was not much education that was provided. Even all the doctors that she went to was like, okay, do this test, do like this, do this investigation, do like this. Nobody actually sat down and made her understand where the problem was coming from, what exactly she could do to rectify it. Apart from medications, what all other alternatives were available for her. So I think when we had a first consultation, uh, we had like almost 1.5 hour session where after listening to her I kind of made her understand everything. We spoke about so many things and she did rectify a lot of things in her life. And I think after 6 months of treatment she conceived after 12 years and she'd given birth to a baby girl and she told me I named her Zainab after you. So I
Wow.
think that was something that really touched my heart. It sometimes feels that even the small things that you do for someone can truly make so much of difference in their lives.
Wow, great. Okay. So a quick tip for work-life balance, especially for women, obviously.
There is no balance. I think the only way to get work-life balance is to build people around you who are going to support your dreams and are going to be available for you. Because otherwise, I think it's very, very difficult for women to manage a house, to manage kids, to also manage work. I have been incredibly grateful to have a supportive partner, to have a supportive family. So I think it's just made the entire journey slightly easier.
Okay, somebody saying this story just made them cry. Yes, definitely. It's very emotional thing. And we had one question about, please check on Zanabin. So my
I think
next question would be like, what would give you more joy? A great result for a patient or a viral reel?
no, a great result for a patient, 100%.
Expected. Expected.
Nothing could top that.
Yeah. Okay.
Okay, so
Please check on the question.
yes,
Thorough open.
this is the question. I would like to know if there is an endometrial polyp of 0.24 centimeter. Just lost it. But does that affect a pregnancy? So an endometrial point 0.24 centimeter is a comparatively small endometrial polyp. It should not ideally affect your trying to conceive journey. We would like to check the location of that polyp based on which we can take a decision accordingly. So if you could please share your ultrasound with me on the DM, I can revert back to you.
There was one more question above it.
Check. Okay, somebody's messaged મારી દીકરી 6 years થઈ ગયા છે ફર્ઝન નથી રિપોર્ટ સગલા નોર્મલ છે મહિનાબેન આપ એમને કહી શકો છો કે મને કોન્ટેક્ટ કરે રિપોર્ટ શેર કરે so I can advise her what is to be done. There's also Nosheen has messaged that you are still struggling with infertility. Nosheen, I would really appreciate if you could DM me or leave me a message on WhatsApp. We can definitely see what we can do for you.
Okay.
Okay.
So that makes me come to my last question, which is
Yes.
one message you would like to give to couples who are trying to conceive for a long time.
Oh my God. Okay. So genuinely something that I would like to say is the trying to conceive journey is very difficult and sometimes it can have no end. But the only thing you can constantly hold on to is hope and faith. So don't give up. There is always light at the end of the tunnel.
Right. Okay. So on that positive message,
And yes,
uh,
don't forget homeopathy.
don't forget. Sorry.
Homeopathy.
Hi. Yes. Right. Okay. So with that message, we end up this amazing session. Thank you so much for this, and we would wish કે જે બી couples try કરવા છે એ લોકોના efforts ને જલ્દી results મળે. મોટાની દુઆથી અને
Definitely,
એ લોકોના family
definitely.
ની દુઆથી અને
Always
સગળાની દુઆથી.
praying ke Saklan, everybody gets what they really desire. It's a very difficult place to be in. I genuinely hope that, God grants everybody's wishes very soon.
Yes. So જેને બી કઈ questions હોય, queries હોય, you can DM Zainabin anytime. I have pinned her Instagram, Raj Clinic. She will be happy to help you. And thank you so much, Zainabin, for making it happen.
Thank you so
And
much for having me, Hussain Bhai. I'm so glad we got to do this after a long time.
yes, yes. Okay. Looking
Yeah.
forward for more such informative sessions. And thank you
Thank
so
you
much.
so
Thank you all
much.
for joining.
Yes. Please take care. Thank you so much, everybody, for joining.